sometimes our strong identity prevent us from seeing things differently. The physician look things like this: 1 + 1 = 2. But my Fulbright friend from socioscience, they see things different. 1 + 1 not always 2. When I come back to Vietnam, it's easier for me to accept different perspectives. And when I give an intervention, usually I try to include the other's perspective to make a combined intervention. And that's great, because after that, I can see that my impact can be maxified many times thanks to using the different perspective. In Harvard, if we know how to include the other differences, our decisions should be much better. That is what I bring back to Vietnam, even in medical education.
Hello and welcome to the Demystifying Healthcare in Vietnam podcast. I'm Beth Ann Lopez, founder and CEO of Docosan. We're on a mission to make getting healthcare effortless and bring you insights from Vietnam's top players in healthcare. On this week's special episode, we're speaking with Dr. Khac Bao, a pulmonologist, clinical researcher, and educator. He's director of the Medical Education Center at the University of Medicine and Pharmacy of Ho Chi Minh City. He's also a practicing clinician at the Dinh People's Hospital and at his own private clinic that he co-founded, the Phoi Viet Clinic. He's a very impressive background, including a master's in medical education from the Harvard Medical School, during which time he was a Fulbright Scholar. He also holds a doctorate in respiratory medicine from the University of Medicine and Pharmacy of Ho Chi Minh City. He completed continuing clinical education in countries including France, Switzerland, and Germany, and has authored publications in The Lancet and many other peer-reviewed journals. So, Dr. Bao, it is really great to be here with you today. And this is a special episode for me, especially, I think, because you were one of the first doctors that we did any user testing for before Docosan even existed.
Oh, really?
Yeah, well, because I remember sitting in your clinic, and of course it was so busy. You've got patients coming in and out, but you still took the time to sit with me and look through our UI, UX and kind of give feedback on the slides to say this would work, or no, this wouldn't work. Yeah.
Okay.
And so that was so helpful in helping us to launch the initial product. So a lot of things have changed since then and grown. So it's very special to be here with you today.
Yeah. Thanks so much for inviting me to come to that talking. Okay. Sharing actually.
Yeah. Definitely. Yeah. And so today we're going to talk about clinical education and lung health in Vietnam.
Yes.
And so in getting started, I'm really curious to hear about what drove you to medicine, and in particular, what made you become a pulmonologist?
35 years ago, when I was in 11th grade, the high school, I was patient, okay? And at that moment, I was taken care by the physician in the hospital of infectious disease. And after suffering from diseases for 1 month, I felt that I want to be a physician. Yeah, because I think one day I can help the other people like me, how to have the other people live better without diseases. That's just the beginning. And I became the physician at that moment. And why did I become a pulmonologist? You know that in 1998, at that moment, I had to make a decision what type of physician I would like to become. At that moment, a lot of my peers wanted to be the physician in cardiovascular diseases. And no one wanted to be the physician who taking care of the patient with respiratory diseases.
And why is that?
Yes, just because at that moment, the cardiovascular diseases are prevalent, of course, and the physicians who are specialized in cardiovascular diseases are well respected, okay? And many people want to be cardiologists. I ask myself, if I want to be cardiologist, who else will take care of the patient with respiratory diseases then? And in Vietnam, actually, the patient with respiratory diseases are a lot. we should have some physician taking care of them too. And the second thought, I think that if many physicians go in a very narrow road to become a physician in cardiovascular diseases, so that the chance for you to meet patient, the chance for you to learn more should be very competitive. Now, if I go into another road to become the physicians in respiratory diseases, I have more time, more chance to learn, and more chance to help my patient. So that I decided to become the physician in lung diseases. And now, thinking back, I think my decision at that moment were completely correct. I can contribute a lot, greatly, to my patient with respiratory diseases.
That's amazing. And so it's always been about serving patients for you.
Yeah.
And so were the socioeconomic statuses of patients with respiratory diseases somewhat different from those with cardiovascular?
Yeah. We know that the patient with respiratory diseases, in general, they are poorer. They come from a lower status of socioeconomic status. Okay. Because of that, they have to work harder, and it's easier for them to get infected by infectious diseases such as tuberculosis in Vietnam, for example, like that. And we know that the infectious disease and tuberculosis are prevalent, are prominent in developing countries like in Vietnam. To be honest, taking care of the patient with respiratory diseases, the patient don't have enough money to pay to the physician. But I think the physician can do more than that. Yeah, not only to earn money, right? But to taking care of the patient is very important for a physician. I think like this.
Yeah.
And when I take care of the patient with respiratory diseases, I can see them like me, the ordinary patient, the ordinary people here. We can be like them in one day. Yes.
Absolutely. I mean, infectious diseases don't care if you're rich or poor.
Yeah, exactly.
True.
But the opportunity to get caught by infectious disease is higher for the poor people than the rich one.
And why is that?
Because, for example, with the tuberculosis is communicable diseases. If you live together with many people in a very narrow space, the chance to be infected is higher. Remember the time of COVID-19. We asked about isolation. I mean, the same idea, the same concept. For infectious disease, if your socio-economic status are not very high, you live in close to each other, you have the higher opportunity to get infected. And if you are poor, you don't have enough thing to eat, you don't have the good nutrition status. At that moment, your immunity is not very high. It's easier for you to get caught by the tuberculosis or other infectious diseases. Yeah. Here we compare the opportunities. Yeah.
I see. And so you practice in both the public and the private sector.
Yeah.
And so I imagine you see patients from all different socioeconomic statuses.
Exactly.
And so what are some of the ways that you guys as physicians can help take care of patients, especially when they don't have money to pay for treatments?
Yeah. In the daily activities, I meet a lot of patients. They don't have enough money to pay to the hospital. And that's the reason why now the Vietnamese government, they want to encourage the people to purchase the health insurance, the public health insurance. Not very expensive for them, but when they have that healthcare insurance, they come to the hospital and the healthcare insurance can cover 80% of their fee. And so that we can reduce the cost for them. That is the first thing. And the second thing is that because of the low healthcare insurance fee, so that we encourage physicians to use generics medication with a lower price, and we economize the use of the tests so that we can diagnose the patient correctly with the reasonable medication. Okay, and in case they could not pay and the hospital try to raise some fund to help the patient with that money. Yeah, sure, we need to do that.
I see. So even like the physicians are aware of cost effectiveness of treatment.
Yeah, sure.
Can
We
take
always
steps.
think of that.
Wow.
Yeah.
Okay. Yeah, because I wonder, because I'm from the US, and there's kind of two major populations. And one is the majority of people that have really good private insurance. They tend to not worry about cost effectiveness at all. And, there's a lot of strange billing practices. But then for certain people, they have no insurance. Everything is like out of pocket. And there needs to be more to be done to serve patients like that, even in the US.
Yeah, I see that. The situation of Medicare, Medicaid in US is one example of that, about that. In the US, when I living without health insurance is something dangerous.
Yeah. In your life.
Yeah, I understand that. Yes.
Yeah, and I guess like you have such an interesting and global perspective since, you did a Fulbright at Harvard, and then you've also done research and studies in Europe. And so like, what are some of the insights that you got from your time studying abroad that you were able to bring back to Vietnam?
Yeah, when I participated in the Fulbright program, I met a lot of people from different backgrounds in life. And due to that different background, they bring about different perspectives. At first, it was not easy for me to get along with them because my identities are quite different from them. And it's hard to accept the other different identity.
So what do you mean? Can you give like an example of like some of that cultural?
For example, the physician look things like this. 1 + 1 = 2. Scientific people always think that. But my Fulbright friend from social and human science, they see things a little bit different. 1 + 1 may be 1 or 3, not always 2. So that their way of seeing things are more fluid than my way of seeing things. And especially when they deal with the human relationship, they deal with that much better than me. And so that when I get along with them, I see the way they see different things. I think I need to think back about my way of approaching things. And at that moment, I see that we have different way to go to the objective, not only one way. Okay? And sometimes it is our strong identity prevent us from seeing things differently. And at that moment, I learned one thing: diversity and inclusion, right? Normally we say diversity and exclusion, but no, diversity and inclusion. And so that I say, I need to change my way of thinking. I need to change my way of approaching things. And when I come back to Vietnam, it's easier for me to accept the other different perspective of the same thing. It's easier for me to listen to what they are talking about. And when I give an action, an intervention, usually I try to include the other's perspective and to make a combined intervention. And that's great. Because after that, I can see that my impact can be maxified many times thanks to using the different perspective. And even in Harvard, the same thing happened. If we know how to include the other differences in our decisions should be better, much better. And that is what I bring back to Vietnam. And so when I bring back to Vietnam, even in medical education, I try to include others' perspective of other lecturers in the university. And even in the management with the patient, I always ask about the ideas of other physicians. And the group consultation is the useful way to enhance the quality of care for the patient too.
Group consultations.
Yes.
I see. And so is that a new practice that you brought to clinical education here?
Yeah, exactly. For example, before, if we think only this is a very hard case and I try to do it by myself, but this time, no, this is a hard case, I need to ask for other perspective. Before, I always ask the people who is senior than me. But this time now, both the senior and junior physician, I will ask the idea. And I can provide the honest question. I don't know, please help me. And so that even the junior physician, he can see the thing quite different from me. And his way of seeing things can bring about the best way to treat the patient. And so that I appreciate their contribution.
Yeah,
Right.
I mean that's very innovative and a very different approach to education and kind of like almost stepping out of the culture. I've noticed the same thing at Docosan too.
Yes.
Like when I first started the company, people would wait and they wanted me to tell them exactly what to do. They're like, okay, no, but what do I do now? What is this? I'm like, well, what do you think? How can we do this? I'm looking for your perspective as well. And they're like, but you're the boss. Why aren't you teaching me? I was like, no, like we all need to bring our ideas together so that way we can do something different.
Yeah.
And I think like for some people it's a big struggle, but for those that get it, they end up being the ones that can change things, that can bring a new perspective. And then in your case, like, helping to treat patients in a way that hadn't been done before.
Yes.
Okay. That's
great.
Yeah, funny seeing how it works, like not only, I guess, like in medicine, it's just a cultural kind of thing. And so you are the director of medical education at the Medical Education Center at the University of Medicine and Pharmacy. And so what is your day-to-day role like there?
The Medical Education Centers of the University of Pharmacy and Medicine at Ho Chi Minh City, that centers have the responsibilities, first of all, to educate, to train other lecturers, other faculty in the university how to teach. Okay, that's the first responsibilities. The second responsibilities is to develop the curriculum. And you know that the University of Medicine and Pharmacy at Ho Chi Minh City now, we are changing our curriculum to catch up with the innovative curriculum in the world. For example, the Harvard Medical School, Texas Medical School, the Geneva Medical School, and we try to build up the new curriculum. In that, the new curriculum, we try to set up the new objective, the new way of assessment of the patient, the new way of teaching. We try to encourage some kind of interactive teaching, not didactic teaching like before. And we focus on developing the soft skill for our student, not only for technical issue. For example, professionalism, we mentioned on that. For example, interprofessional education, how to work well with nurses, with pharmacists, with the public health worker, for example, like this. And together, we want to train the new physician. We hope that one day, University of Medicine and Pharmacy at Ho Chi Minh City can train physician at Harvard Medical School can train. That's our dream to do that. And my role as the directors of that medical education center, that means I delegate the responsibilities and I try to find out which faculty members, they have the shared vision, they have the enthusiasm to join into that journey and try to develop them and try to allocate the task for them. Together, we can achieve our common goal to build a better curriculum, to build a better physician for Vietnam.
That is so amazing. And I love that vision of bringing world-class care, world-class education to Vietnam.
Yeah.
And it makes sense. There's so many people like you that have gotten an international perspective, seen that things can be different and want to bring that knowledge here and improve things here in Vietnam.
Yes.
So I guess like something I've been thinking about is like the medical education system in Vietnam. A lot of it is based on kind of apprenticeships. right? Where after you finish medical school, you go and work at a public hospital and study under, it's kind of like learning and doing at the same time. But one of the potential kind of issues with that education system is that there can be big variations in quality depending on where the student goes to study. And it's something that I've noticed too, just kind of in general medical practice here, is like there's not a lot of standardization. If you go to 5 different dermatologists with the same condition, you might get 5 different kind of like treatment workflows. And so is that something that you guys are addressing over at the education center?
Yeah, that's a big thing now. After graduation from the medical school, the students are expected to go into the hospital to practice. And as you said that, we have different hospital. We have different lecturer then, faculty then. And so that we cannot make sure about the qualities of the physician going out of the hospital at the end of the session. And the Ministry of Health had a lot of initiative to address that. First of all, they try to train the physician working in the healthcare site to become the faculty. Yeah. And so that not every single the healthcare site can receive the newly graduated medical student. Only the healthcare site who have enough physician qualified for teaching. And those physicians need to go for training. And our medical education center train them to provide them with enough competency how to teach other people. That is the first thing. That for the healthcare site. And for the medical student, we plan to organize the national medical examination. And so that regardless of your medical school, you need to pass that national medical examination to obtain the license to exercise as a physician. And because of that, we can standardize the outcome of the physician. And we know that the testing drives learning. And so that by issue the national medical examination like this, we can standardize the qualities of all physicians in the whole Vietnam. And the first national medical examination will happen in 2027. Yeah, and now we are preparing to make that happen. And the government had already put all of the thing into the law. Yeah, the law of the healthcare law. Yeah, that will be effective from the January 2024. That means in 2 months.
In 2 months, yeah. Yes. So it'll be official.
Yeah.
Okay. I guess it's kind of like the US MLE equivalent.
Exactly.
For Vietnam, right?
Exactly. Okay. But we have a lot of things to do that, to make that happen. And we wish that one day Vietnam will have such kind of US MLE. Yeah.
I think you'll put it in place, Dr. Bao.
Yeah, of course. I'm the key player in that process. Yeah.
Awesome. Do you think that we'll ever see specialty boards in Vietnam? So in the US, a lot of the medical associations have like their own, like a board of like plastic surgeons, and you have to pass a specific exam in order to get that particular expertise. Do you think that that is on the roadmap as well?
Yeah. In Vietnam, actually, we have such kind of professional society. For example, now, I'm the specialist in lung diseases. We have the Ho Chi Minh Respiratory Society. We also have the Vietnam Respiratory Society. And in those society, the physician in the same specialty work together. And together we drive the guideline, the national guideline, something like that. And we organize some CME, continuous medical education, to train for the physician in the same specialty to develop more and more. Up to now, in the professional association, we don't have such kind of official board to organize some examination for the physician. But I think that will be the story of the futures. In the future time, I think the CME should belong to the professional society like in the other country in the world.
Yeah, so it's really interesting. Yeah, just to see how the path of medical education is changing so much
Yeah,
over time and
exactly.
developing quite
We
rapidly.
change a lot. Yes.
That's great. That's really great. Okay, so I guess going back to your expertise as a pulmonologist in particular, how does the environment and socioeconomic status of people here influence the type of lung diseases that people face? You mentioned about TB earlier, but what are other common diseases that you treat at your practice?
You know that in Vietnam, we talk about tobacco smoking. A lot of Vietnamese people smoke. And we say that 45% of the male adult in Vietnam smoke. And because of smoking like that, we have a lot of smoking-related lung diseases. For example, COPD, chronic obstructive pulmonary diseases. That is the first thing. We have a lot. Besides tuberculosis, that is communicable diseases. And later on, we have a lot of patients with asthma. With the industrialized life here, we have a lot of allergen. Yeah. And a lot of allergies in our patient. And we have more and more patients with asthma coming from our office. And another thing is the obesity pandemic. We say pandemic. We might not see them 20 years ago, but now with the development of the economy, the people eat more and they don't move a lot. And so that obesity increase, and we have more and more patients with sleep apnea, obstructive sleep apnea. The patients who are obese and they snore during night, and daytime they feel a sleepiness all of the time. Yeah, and we have that. And we see that trend. Now, we still see a lot of patients with tuberculosis, but at the same time, the non-communicable disease such as COPD, asthma, and obstructive sleep apnea increasing also.
Yeah, so I guess like development kind of is a bit of a double-edged sword.
Yes.
We've got all these nice things like, McDonald's and Pho 24 and, all this kind of stuff. But the diets are changing so quickly. And I see, especially in our area, even with my staff, to go across the street, you take the motorbike instead of walking.
They don't want to work.
Yeah.
Exactly. Yeah.
Man, so like, what can you do to advise your patients to prevent that? Are they aware that this change is happening in the population?
As a physician, we try to reduce the percentage of the people who smoke. And I wrote the national guideline on smoking cessation. Oh, wow. And with the smoking cessation, we try to educate people to quit smoking. Yeah. And we can run some campaign to prevent smoking in the younger generation so that we can reduce that risk factors. Smoking is the risk factors, the high risk factors. The secondly is the pollution. Yeah. And nowadays we have more and more the study on the environment. Yeah, here. And you can show that the pollution in the cities is increasing also. And normally we talk about that issue to our patient and we advise them about the measure, how to improve the quality of air around them so that we can control that. And for the communicable diseases, for example, COVID, pneumonia, and influenza, and now we have the campaign to vaccinate to the people. COVID vaccination, pneumococcal vaccination, influenza vaccination, and later on we will have RSV vaccination, herpes zoster in vaccination. And with those things, we can have to reduce the risk factors of the lung diseases.
That's great. And it's something that I admire a lot in Vietnam is I think that they value public health a lot, and public health initiatives also become like quite central in society. Like I saw how at the beginning of the pandemic, they handled the COVID outbreak with, very intensive tracking and social messaging. Yeah. You would see like the, mask wearing signs all over the place. People really followed it. I guess I'm curious about the tobacco issue because I didn't realize that so many, especially men, are smoking here. Why do you think that is? Is it cultural or is it like, is there a strong tobacco lobby here? I have friends that work in the Ministry of Health in Japan, and they say that the tobacco lobby there is just so strong, and they, they constantly struggle to kind of, get that public health messaging. And so, can you talk a little bit about that?
Actually, the government have done a lot of things to control tobacco. To compare with 20 years ago, in the street, when they stop the motorbike, you can see around you a lot of people smoking. But now, you could not see that image very frequently. Before, when you went into the hospital, it was easy for you to see patients smoking. Oh, no. But now, when you go into the hospital, it's very hard for you to see someone smoking inside the hospital. And in the event now, you can see that the number of the people who smoke is reduced a lot. Okay? We have a lot of regulation on the tobacco advertisement. We have the strict ban on that. And we have the fund, the anti-smoking fund. And we create that fund using the tax from the tobacco's material also. 1.5% of the tax on tobacco will run directly into the fund against smoking. Yeah, and we have a lot of campaign to educate the population about the bad influence of smoking also. And we hope that with all measure, we can reduce that. And you know that Vietnam had that one law against smoking in the public area too. Yeah, we have that law in 2013. Yeah.
Oh, that's great. I mean, that's more progressive than some places. I'm always shocked when I go to Europe and how many young people are smoking outside and stuff like that.
Yeah, but now we don't see a lot. Yeah, yeah. That's great. The better. Yeah,
definitely. And then the second thing is you said that you advise the patients on how to reduce their exposure to, pollution. Can you talk some more about that? I had heard before that if you live in a polluted kind of place, it can be just as bad as smoking.
Yeah, smoking is one thing. And the other thing is about the people attitude who create the pollution here, ourselves, not other people. You use the out-of-date car. Yeah, that is something not good. Okay? And when you use the material to cook at home, you can create the pollution too. So that the education for the people themselves, how to reduce the population by themselves. Yeah, for example, you use the electric cook rather than you use the wood to cook. For example, like that, you can reduce the smoke. Okay? And you have to use the good car, the good motorbike, not the old one. At that moment, you can reduce that too. You don't smoke in the public area. You can reduce the population too. And at the same time, we need to encourage to moving out of the city, the big factories inside the cities, because those factories is the main source of pollution.
Yeah,
those things.
Yeah, there's such a big difference. I notice that sometimes I stay in Ho Chi Minh City during Tet. Yeah. And it's clear, it's because everyone is out to the countryside to go back to visit their families. And you're like, wow, it's so clear.
Yeah, exactly.
So there's a lot of stuff we can do to
in the inner cities is polluted. Yeah, a lot of things to do to reduce that.
And so, and then the last thing that you mentioned too is about, the chronic diseases. And so, how many obese patients are you starting to get? And then how do you tend to counsel them on, taking care of their lung health?
For the obesity patient, in my case, I received the overweight patient because of OSA, obstructive sleep apnea. And in my specialty, first of all, I encourage them to have the better nutrition and the better exercise. But at the same time, I prescribe the medication to reduce the weight for them also. And in that approach, I can have a lot of people to reduce the weight and they can live better with the OSA. Yeah.
So have GLP-1 medications become more popular? Like Ozempic
The medication?
and Wegovy. Yeah.
The medication to reduce the obesity?
Like semaglutide.
Yeah, actually you have some medication to inject to
Yeah.
reduce the weight.
Exactly.
Very effective now. We have that medication already in Vietnam now. And actually now in the world, if in the world they have some new medication, right away in Vietnam we have that. That is the luxury we have now. That's quite different from before. We have to wait for for years to have the new medication. But now if in the world they have the new medication in Vietnam, we can have that.
Yeah, and one thing too that I see is that like even in the pharmacy chains like Long Chao, you can get the medicine delivered to you so quickly.
Yes,
Like,
exactly.
it's incredible.
Exactly.
It's like, there's nothing like that in the US to get the prescription and then you wait and then you pay a huge amount versus like here, if you've got the prescription, they'll send it to you within 2 hours.
Yeah, exactly. The service here is quite good. For pharmacies, we have the group of pharmacy here in this city that can provide you the good service. Yeah, at home. And great.
Yeah, cool. Well, it's interesting to hear about that. And so you do so many things. So you are, the head of continuing medical education, the University of Medicine and Pharmacy. You work in the public hospital, and you also co-founded a private clinic. And so can you tell us about your journey to co-founding a clinic and why you did that?
Yeah, actually, to build Phoi Viet clinic was one of the things I think the good thing I have done. At that moment, you know that in Vietnam, to exercise well is quite hard because the regulation, because we have some kind of system, some kind of hierarchy is very strong. And sometimes one physician, they want to do something, they need to wait for a bit of time so that whether his or her leader accept or not, allow him to do what he wants. And I think we need to do something to apply what we can learn from abroad to Vietnam. I know that when I came back to Vietnam in 2005 from the studying from France, at that moment I learned OSA, obstructive sleep apnea. When I came back to Vietnam, I think that I can apply that right away. But I make the suggestion, the proposal to submit to the hospital where I work. But the leaders, they did not share my same vision at that moment. Maybe he think the cardiovascular diseases is more important. They might think the surgery is more important. So that obstructive sleep apnea and sleep medicine might not be his priority at that moment. And I need to wait 6 years from 2005 to 2011 without any signal that the hospital will do something like sleep medicine. At that moment, I say that, no, I could not wait my whole life to make things happen. If the hospital doesn't want to do it, I need to do it by myself. And so that I met with my peer and we share our view, our vision, our willingness to do things. And at that moment, to open a private clinic is a good thing to do because in the private clinic, we can decide with technology to invest and how to go. And because of that, I can open the first sleep lab in Vietnam in the Phoi Viet clinic.
Wow, I didn't realize that. So you guys opened the first sleep lab in Vietnam.
Yeah, exactly.
Wow.
Just before that, they didn't think that's very important. But because I have learned about that, I knew that's very important, but it's hard for me to convince many people, a lot of people to do it. And so that I think if we want to convince other people, you need to do it first so that I do it. And now the sleep medicine is generalized and we can even build the Vietnam Society of Sleep Medicine and I'm the vice president to that society. Yeah, and now we have many other physicians who can share the technology and their willingness to take care of the patient with sleep disorder, right? You see, that's the reason why I opened up the Phoi Viet clinic, just to realize my dream, my willingness to contribute more to the societies.
You were such an innovator.
Yeah, exactly. Just like you, Docosan, you want to have the connectors with the patient, right? And the physician. Yeah.
Well, I really understand that kind of sense of urgency, right?
Yes.
Like if I don't do it, then who is going to?
Yeah,
right?
we should
it
go.
takes someone that needs to do something different and bring about that
we want
change.
to do things different, actually.
Yeah. And so speaking of new technology, beyond sleep medicine and these other kind of clinical tools that you've used, are there any other parts of new technology that you're excited about?
Yeah, as said, when I opened up the Phoi Viet clinic, not only for sleep medicine, but at that moment we can invest on new technology. For example, at that moment, we invest the FeNO, that's to measure the inflammation in the airway. And that helps us to give the precise and accurate management for asthma. Okay? And that was one of the first centers in Ho Chi Minh City who had that tool too, right? So that we can invest several new technologies and we use that technology to improve the qualities of diagnosis and the quality of care for the patient. And in Phoi Viet Clinic, I have the free to do what we want to. Yes, I love it.
And I noticed too, like even like years ago, you guys were already starting to do telemedicine.
Yeah.
I would see the webinars and stuff you guys would post on Facebook.
In the COVID-19, those were the big opportunities for Phoi Viet also. The challenge, yes, but the opportunities. At that moment, many different healthcare sites, private ones, they closed because they could not receive the patient. And in Phoi Viet, we decided who will take care of our patient if we close our activities. At that moment, we open up the online examination, the online consultation, and so that we can maintain the connection to the patient. And when the patient have any symptom, they have had that online consultation with us. And after the COVID-19, we continue to run that service because you know that the patient coming from Phoi Viet, they come from many different provinces in Vietnam, some in Hanoi, some in Hà Giang, some in the Cà Mau, very far away, so that they could not come to Phoi Viet very regularly, not every month, not every week. And so that the first time they come to see us, we examine them, we do some tests, we prescribe them the medication, the patient come back to their hometown, and next month we make the online consultation to Phoi Viet so that the physician and the patient can see each other, can ask, can chat with each other. And if needed, we can ask the patient to do different tests at their hometown also. They can send us the results so that we can see and we prescribe them more. Just in case they ask our patient come back to see us offline. But for the patient who live very far from Phoi Viet, they can have the online consultation with us. Yeah, and even for the patient who are so busy, they could not come to the office, to the Phoi Viet clinic very frequently, we accept the online consultation too, depending on the patient need. And we think, Phoi Viet think that by continuing the online service like this, we can provide better health care for our patient. Yes, we can attract better the patient needs.
Absolutely. And improve access too. Because if you have patients from all over the country, as far as like the southern tip of like Khac Bao, who are able to get care and see like, you know, top physicians in Ho Chi Minh City, that is something incredible. So you've been able to do so much in your career and you're still fighting to change things for the better. And I know a lot of people must really look up to you in your career path. And so do you have any advice that you would like to leave for any future entrepreneurs in healthcare that want to change things for the better like you?
To give them advice is hard. It's hard to do that because I think every people will hit different challenges in life. And depending on the challenges you hit, depending on the opportunities and the resources available to you at that moment, you can overcome that challenge and create new things. If I have to give one advice, I think that ask and listen very careful to your partner and never do alone. And please go in team. And only with a team, efficient team, you can go very far. If you want to go alone, you can go very fast at the first moment. But after that, you get exhausted very quickly. And that is what I've done for Phoi Viet Clinic and for other activities I join. And I always say that I get the successful and that success like this today, that's because of my team. I thank my team a lot. I appreciate their contribution. Yeah.
I think you must have an eye for finding really good talent too, because I remember you mentioned at the beginning about finding the kind of top star like lecturers over at the University of Pharmacy who want to change things for the better. And then of course, like co-founding the clinic, you did it with these other top doctors who believed in the same thing that you did. So how do you go about finding people that complement your skill set that help you to go far?
From my perspective, the top specialists are very important. But the more important thing is the vision. I try to find the people who share my common vision. That's more important. And I believe in education. I believe in training. Today, you don't know how to do this or that. That doesn't mean tomorrow you don't know. Providing that you are willing to listen, to learn. And so that in Phoi Viet Clinic, for example, every week we have the CME activities. All physicians in Phoi Viet need to meet each other. We learn together. We invite other experts in city, in Vietnam, in the world, come to teach us more. And we believe that education, training, make things better. And so that I don't go around to find the top specialists, because you know that if you want to have the top specialist like this, you might not afford it. They are so expensive. But if you can share your vision clearly, communicate your vision clearly, it is easier for you to get the new partner with a lower price, and they have the heart like you, and they go with you for a long time. And always I find the people who have the common vision, not the top specialists.
I think those are very, very wise words.
Yeah.
So, Dr. Bao, thank you so much for this really incredible, insightful conversation. Our listeners can find Dr. Bao at the Phoi Viet Clinic in Ho Chi Minh City. We'll put the links to book him online on Docosan in the description. So, thanks for joining Demystifying Healthcare in Vietnam, and we'll catch you on the next one.